Hey everyone, and welcome to the Deep Dive.
Mm.
You know we love to get our hands dirty with some fascinating dental topics, and today is no different. Immediate full arch loading, that's what we're tackling today.
Yeah, that's right.
And to help us navigate this fascinating world, we've got a presentation by Carl Horton and Will Murphy to guide us. I've had a sneak peek, and trust me, you guys are in for a treat.
Yeah.
This can totally change how you think about dental implants, so...
Yeah, I think game changer is a word that gets thrown around a lot, but I think this one really, really fits, especially if you've ever struggled with, what dentists call failing dentition.
Failing dentition. Okay, that sounds a little scary. What exactly are we talking about here?
Well, it's basically when your teeth are, in really rough shape, maybe beyond repair. We're talking loose teeth, painful teeth, maybe even missing teeth altogether.
Oof, yeah, that sounds rough.
Hey, the source material really paints a pretty bleak picture. Dentures that just don't fit right, constant discomfort, and even this sense of hopelessness, it can really impact a person's quality of life.
So it's not just about aesthetics then?
No, not at all. It's about restoring, functionality, confidence, overall well-being. And that's where immediate full arch loading really shines. I mean, imagine this. You get a full set of fixed teeth on the very same day your implants are placed.
Wow. Okay, now that sounds pretty amazing. But how does that even work? I mean, practically, how does it work?
So it involves, strategically placing the implants often at an angle, to maximize the support and stability.
Okay.
You can kind of think of it like building a really strong foundation for a house. And a classic example of this approach is the all-on-4 concept.
Okay, yeah, I heard of that.
Pioneered by Malo Ranger and Nober back in the early 2000s. And their research really showed just how effective this technique could be for, rehabilitating entire jaws.
So you're essentially rebuilding the entire arch of teeth in just one day.
That's the goal.
Wow. But I'm guessing not everyone's a good candidate for this, right?
Mm-hmm. Right. And that's a great point because it all starts with a really thorough medical evaluation. There are some conditions like, recent heart attacks or active cancer treatment that would make this procedure unsafe.
Makes sense.
Even certain medications like methotrexate require extra careful consideration.
So it's not just about the mouth, it's about the whole person.
It really is about the whole person. And beyond the medical side, there are those lifestyle factors. For example, smoking is a big red flag because it really, really reduces the success rate of implants.
Oh, yeah. Makes sense.
And we even delve into the psychological aspect. There's this questionnaire that really helps us understand the patient's motivation, their expectations, and, their overall understanding of what's involved. It's about making sure they're making an informed decision and that they're really prepared for the journey.
So you're really considering all aspects of a person's well-being before jumping into this.
Mm-hmm.
I like that. So once someone's deemed a good candidate, what happens next?
Well, that's where technology takes center stage.
Ooh, I love some high tech.
We're talking about things like panoramic radiography, intraoral scanning, and even CBCT scans to create this super detailed 3D map of your mouth, like a blueprint for your new smile.
So we're not just talking a quick peek with an X-ray anymore.
Oh, no. This is about creating a really precise, personalized plan.
Okay.
And to really help you visualize the final outcome, we use tools like diagnostic wax-ups. These are physical models that show you exactly what your new teeth will look and feel like.
So it's like getting a sneak peek of your new smile. That must be so cool for patients.
Oh, it is. It really helps to manage expectations and make sure both the dentist and the patient are, totally on the same page.
That makes sense. Okay, so we've got the diagnosis, we've got the plan. Now let's talk about the actual procedure itself. What's going on there?
Okay, well, this is where the artistry and technical skill of the dentist really come into play. First, they'll select the materials for your new teeth.
Okay.
There are options like acrylic, PMMA composite, and even zirconia titanium combinations.
Wow. Okay, so that's a lot of choices. How do they decide which one is right for a particular patient?
It really depends on a lot of factors, like your bite strength, aesthetic preferences, and even budget. If you're looking for a strong and durable option, zirconia titanium might be a good choice. Acrylics are often used for temporary restorations because they're more cost-effective.
So it's kind of like choosing the right building materials for a house. You've got to consider the strength, the look, and the cost.
That's a great analogy. And just like with a house, a solid foundation is absolutely crucial.
Right.
That's why the next step is choosing the right implant placement protocol. We have freehand pilot-guided and fully guided techniques.
Oh, I'll be honest, those sound a little technical. Can you break those down for us a little?
Sure. Let's go back to the house analogy.
Yeah.
So freehand is like building a house with no blueprints, relying solely on the builder's skill and experience. Fully guided, on the other hand, is like having a detailed 3D model that guides every single step, ensuring maximum precision. We even have tools like the ISQ Osto that actually measure the stability of the implants to make sure they're really securely in place.
So it's like a GPS for your dental implants.
Yeah, exactly. And in some cases, we might need to do some landscaping before we build.
Landscaping? Are you talking about planting trees now?
Well, not quite trees, but bone. Sometimes the jawbone isn't strong enough to support the implant, so we need to do bone augmentation.
Okay.
This means adding bone grafting material to really build up the foundation and make sure we have a nice solid base for those implants.
So you're creating a stronger foundation for those house implants to sit on. I love the analogy.
Exactly. It's all about setting things up for long-term success.
This is all so fascinating. But before we get ahead of ourselves, let's take a quick step back and recap what we've learned so far.
Okay, so we started by understanding what failing dentition is and how it can affect people's lives. Then we talked about immediate full arch loading as a solution for that.
And we dove into that high-tech world of dental diagnostics and planning. You know, how dentists are using 3D imaging and modeling to create personalized treatment plans.
We even touched on the different materials used for those dental implants and the different techniques for placing them, emphasizing, how important it is to get that proper stability and that bone augmentation if it's needed.
All right, so I have to bring up this quote from the source material because it really caught my eye. Usually my number one concern, often the carpentry, is the easy bit.
Oh, yeah.
I thought placing the implants was the hard part. So what's so important about the temporary prosthesis then?
That's a fantastic question, and it might surprise you to know that it's not just a placeholder.
Okay.
It plays a really vital role in the healing process and the long-term success of those implants.
Okay, so more than just aesthetics.
Yeah, definitely. Think of it like a sculptor's mold, After those implants are placed, the dentist takes impressions to, create this model. And that model is used to make the temporary prosthesis. And it's carefully shaped to, fit comfortably and guide the gums as they heal around the implants. So it's all about creating that natural and, aesthetically pleasing outcome.
So setting the stage for the final reveal.
That's a great way to put it. And just like any good stage production, there's, rehearsals, adjustments. The dentist will have you try on that temporary prosthesis multiple times, make sure it fits well, feels comfortable, and provides the correct bite.
I talked about a patient named Mrs. G earlier who had a severe gag reflex. I imagine that presented a unique challenge during this phase.
Oh, absolutely. Cases like Mrs. G's, they really highlight how important it is to consider, the individual patient's needs. Her dentist had to be incredibly meticulous in designing and fitting that temporary prosthesis to, minimize any discomfort and make sure they weren't triggering her gag reflex. So it's a real balancing act between function and patient comfort.
The dentist needs to be part artist, part engineer, and part psychologist.
Yeah, you could say that. They need to be able to problem solve and adapt their approach for every single patient. And, while that temporary prosthesis is busy doing its job, shaping the gums, protecting the implants, those regular checkups are absolutely essential during this healing period. The dentist will monitor your progress, make any needed adjustments, and, make sure everything's healing as it should be.
So it's not like a set it and forget it kind of thing. There's a lot of care and monitoring involved.
Right, exactly.
Now, earlier we talked about how things don't always go perfectly, even with the best care.
Mm-hmm.
So what are some of those complications that can pop up?
Well, the research has, identified two main types of complications. Technical and biological.
Okay.
Technical complications, those might be things like fractures in the prosthesis, screws loosening, or even a screw breaking. And these are often related to, the materials or the forces on the prosthesis.
So choosing those durable materials and being careful not to put too much stress on your new teeth is really important. Now, what about those biological complications? What are we talking about there?
Biological complications, well, those involve the body's response to the implants. So, for example, you might see bone loss around the implants, which obviously could weaken their stability. Or you might have gum recession, where the gums pull away from the implants, exposing them. And then sometimes you might see an overgrowth of gum tissue, which can be uncomfortable and kind of affect how things look aesthetically.
Sounds like catching any of these issues early on is crucial.
Oh, absolutely. And that's why those regular checkups are so important. That's when the dentist can monitor how you're healing and identify any potential problems so they can intervene early before things become bigger issues. The source material recommends checkups, at least once a year and even more frequently if there are any concerns.
Okay, so let's say everything heals perfectly. The temporary prosthesis has done its job and it's time for the permanent one. What's the long-term care and maintenance look like for someone with immediate full arch loading?
Great question. And it's one that, I really emphasize with all my patients. Because while dental implants are super durable, they're not invincible. Proper maintenance is really the key to making sure they last a long time.
So what exactly does maintenance involve? Is it like taking care of your natural teeth?
It's similar in a lot of ways, but there are some things to keep in mind. Regular brushing and flossing are obviously essential. But, you really need to pay extra attention to the areas around those implants. There are special tools designed to clean those areas really well to prevent, plaque buildup and inflammation. So a little extra effort, but totally worth it to protect your investment in your smile. Absolutely. And even though you'll still see your regular dentist for those general checkups and cleanings, it's a good idea to see an implant specialist every so often too. They have that specialized expertise, and the tools to monitor the implants give them a really good cleaning and catch any potential problems early.
So like having a dedicated mechanic for your smile.
That's a great way to put it. Regular maintenance, it's an investment in the long-term health and success of your implants. Could potentially save you time, money, and discomfort later on.
Makes sense. All this talk about maintenance makes me wonder, how long can these implants actually last?
Oh, the million-dollar question? And there's no easy answer because, it depends on a lot of things, your overall health, oral hygiene, lifestyle habits. But in general, dental implants are considered a very long-lasting solution.
So not just a quick fix, but a potential solution that could last a lifetime.
That's the idea. With good care and maintenance, dental implants have the potential to last for decades, giving people back their smiles and their confidence for years and years to come.
This has been so eye-opening. We've covered a lot of ground today. From understanding the basics of this immediate full arch loading to the importance of that temporary prosthesis and the long-term care, and there's still so much more to uncover. Join us for the last part of this deep dive as we explore what the future holds for this amazing technique, and what that means for dentistry as a whole. All right, we're back and ready to wrap up our deep dive into immediate full arch loading. We've really gone through it all, haven't we? The procedure itself, all the tech, the importance of aftercare, you name it. But what about the future? Where do you see this whole field going?
Oh, man, it's an exciting time to be in dentistry, let me tell you.
I bet.
The technology, the materials, everything's moving so fast. And I think the future for immediate full arch loading is, it's incredibly bright.
Okay, so give us a little glimpse into that future. What kind of innovations are we talking about?
Well, one area that I'm really excited about is how digital technology keeps getting more and more integrated.
Yeah.
We're already using 3D imaging, computer-aided design, heck, even robotic-assisted surgery in some cases. And it's all about making things more precise, more efficient, less invasive for the patient.
So even more high-tech wizardry in the dental chair.
You got it. And I really think we're going to see this big push towards even more personalized treatment plans.
Oh, awesome.
Imagine using someone's, genetic information, their detailed scans, to actually predict how their body is going to respond to implants. And then we can tailor the treatment plan just for them. Heck, we might even be able to create customized implants that perfectly match their anatomy, their bone structure.
Wow, that's incredible. It's like taking personalized medicine to a whole new level.
Exactly. And on that note, we're seeing some really cool stuff happening with biomaterials too.
Oh.
Yeah, researchers are creating these new materials that promote, faster healing, that integrate better with the bone, and even have antimicrobial properties to lower that risk of infection.
So you're not just trying to make the procedure better, you're trying to help the body heal better.
Yeah.
And really adapt to those implants.
That's the goal. It's got to be this holistic approach that, combines that cutting-edge technology with a deep understanding of how the body works.
Now, that is what I call the future of dentistry. But, with all these advancements, we have to think about the bigger picture too, right? What are some of the challenges that come with, this field that's moving so fast?
That's a great point because it's not all sunshine and roses, right? One big challenge is making sure all these cool advancements are accessible to everyone, not just a select few.
Right, of course.
The cost of technology, the specialized training, all that can really create barriers. So we have to figure out how to make these treatments more affordable and more widely available.
Yeah. It's like any other breakthrough in healthcare, right? We've got to make sure the benefits reach the people who need them most.
Absolutely. And another thing to think about is the role of the dentist and how that's going to keep evolving.
Awesome.
As technology gets more and more sophisticated, dentists have to stay ahead of the game. They've got to be constantly learning, adapting to those new techniques and materials. It really takes a commitment to lifelong learning and a genuine passion for innovation.
It sounds like the future of dentistry is just as much about that human element as it is about the technology.
I think you hit the nail on the head there. At the end of the day, it's all about using these incredible advancements to make people's lives better, give them back their smiles, boost their confidence, and just improve their well-being overall. And that takes compassion, empathy, and a deep understanding of what it means to be human.
Couldn't have said it better myself.
Yeah.
This deep dive into immediate full arch loading has been incredible. I mean, we've gone from the nitty-gritty of the procedure itself to all that amazing technology and then the challenges and possibilities for the future. It's been a wild ride.
It has, and it's been a real pleasure sharing my thoughts with you and your listeners.
And all our listeners out there, thank you so much for joining us on this journey. We hope you've walked away with a whole new appreciation for the artistry, the skill, the sheer innovation that's shaping the future of dentistry. So until next time, keep exploring, keep learning, and most importantly, keep smiling.